I'm Dr. Sridhar. I'm a consultant neonatologist and currently I work at Alain Mediclinic. And the question of how much to feed the baby often comes up. So this is not an easy question to answer. Primarily, it depends on the baby's requirements, and each baby is different in how much milk they need. For example, if a baby is exclusively breastfeeding, what we say is don't worry about how much the baby is getting, as long as the baby stays satisfied, and how much weight gain is there, how much urine output is there, is going to guide you. Again, the weight gain pattern differs from baby to baby. It depends on the baby's own growth centiles. So if a baby is small at birth, they may continue to grow on the smaller side. So don't expect them to grow faster or to feed more just to gain weight faster. So allow the natural pace to take over, and you have to familiarize yourself with growth charts. I have videos on growth patterns. If a baby is growth restricted, making them grow faster isn't good for them. So that is one of the important things that you should be familiar as well. So if the baby is starting to breastfeed in the first 2 to 3 days, it will be every 2 to 3 hours. Frequent feeding is important for the milk to start coming. And as the feeding establishes, the mother's milk starts coming in, you see that the baby is starting to sleep well, the baby passes more urine, and this will ensure that the weight gain is continuing as well. If the baby is slightly jaundiced, don't be worried, because some jaundice is normal and the doctor will be arranging to monitor the jaundice as well. So the first 3 to 5 days, there may be a slight gap between the mother's production and the baby's ability to take the feed. So especially if you have previous babies, your milk starts coming in faster than the baby can cope. So you might feel engorgement. If the breast becomes hard at this stage, you may need to express some milk before the feed. And if the baby is agitated, you can give that express milk in a cup to calm down the baby, and then keep the baby on the breast. So this will help the baby to settle down better. Sometimes the milk spurts when the let down reflex is strong. In these cases, you can feed the baby lying back and keeping the baby slightly up, or the same technique which I explained, express a little bit and then start feeding the baby. This would help as well. So choking during feeding is a concern, and there is a video I've shared earlier. If you're worried about that aspect, drop a comment and I can share the link with you. If a baby for any reason needs formula milk, as I said, support the milk output yourself. Use a breast pump as far as possible for every feed. After the baby has fed from you, express milk, and use that instead of using the formula. That will ensure that your milk production is increasing and you're not relying on the formula. However, if for any reason you need the formula at a regular pace, for example, you start at work and you don't have enough milk stored, the quantity to feed should be again decided on whether you are doing mixed feeding. If you go too fast on the formula, the baby will not be satisfied with the direct feeding at any stage, because they are not going to get that much from the breast directly. So the confusion may cause the baby to tilt towards, or the parent gets stressed and tilts towards the formula feed. So anything we do, we should try to keep the breastfeeding in priority. So the tin of the formula advises you of a certain volume. I request you don't follow that, just ignore it. Look at how much you are expressing at each feed and consider that as a volume that the baby may take. For example, in the first month, the baby takes 60 to 90 ml per feed every 3 to 4 hours. If your baby is breastfeeding, they may feed 2 to 5 hour interval. So I suggest that you don't rush to feed the baby immediately. If baby cries after half an hour, 40 minutes, you try to hold the baby, cuddle, and check for other reasons why the baby is crying. Because the quicker feeds gets into a snacking pattern, the baby takes small frequent feeds and doesn't settle down well, and it leads to more problems with colic and passing excess stool. So you can have 1.5 to 2 hours as a reasonable minimum gap, and if the baby starts sleeping well, the once you know the milk has come, the weight is increasing, you can allow the baby to sleep 5 hours at a time. The formula milk or the express milk, if you're exclusively feeding that, you will need 60 to 90 ml, and the 60 to 90 range depends on the size of the baby and how frequently they are feeding as well. The next month you can increase by 30 ml or so from that level, and again it depends on the gap between the feeds. The babies can start sleeping 5 to 6 hours by the second month. You don't need to wake them up in between that if they're sleeping. If they have a pattern of sucking feeds too often, if you are on bottle feeds, try to space it more. If you're on breastfeeds, you can titrate, leave it to the baby's demand, but don't overinterpret the baby's hunger cues and overfeed, because that's not ideal as well. One important concept here again is physiologic lactose intolerance. So the lactose is a milk sugar, and there is a certain amount of lactase enzyme that the baby has at the beginning. It quickly upgrades as the baby gets exposed and to the milk, and the digestive ability of the lactose increases. But this is a gradual process. It takes 7 to 10 days, and if you are exposing the milk too much milk in the baby to too much milk in the early stages, like if you are multigravida and you're feeding more than you need to feed, or if you're bottle feeding the baby starts getting colicky or has abdominal discomfort. So you start worrying that the baby is hungry and you start feeding the baby more. This leads to a cycle of reflux and vomiting as well coming on top of that. So remember that here you are starting the problem yourself by giving the baby more milk than they can digest. They don't really need extra volume in the initial stages when they are learning to digest and cope. So please remember this point. And overfeeding is a common problem and it leads to reflux. The baby has more colic if you have an excess lactose load. They may pass loose stools, get nappy rash as well. This is called physiologic lactose intolerance, which is aggravated by our giving more milk. So try to titrate the milk volume to your baby's needs. Monitor the growth on the growth chart proportionate to the baby's centile, and don't be pressured to give more milk because the baby cries more. Around 4 to 6 weeks, all babies get colic, and you can tolerate it. You can manage it with some variations in your routine handling, but it tides over eventually, and you don't need to be worried about it.